Thank you very much for the invite. So anybody that knows me and Janice knows that the fact that we've been asked to do a joint presentation in 10 minutes is going to be a particular challenge. But anyway, we're going to try and rise to that challenge. When I was thinking about what permission to lead means and what it means specifically for East Renfrewshire, it came down to three things. And the first is that the work is clearly focused on ensuring that the leadership comes from survivors, that the approach is based on women, children and young people with lived experience, changing the services that impact on their lives and making it better for other survivors. And most importantly for them, helping to stop violence against women from happening to other people in the future. That's an absolute priority for the women that we support through the expert group. In East Renfrewshire, our peer support group has been working with the Violence Against Women Partnership to work with them and to lead on a number of areas of work. The process has been meaningful for the women involved. It's led to changes that the group have been kept up to date about and have been consulted on, and they feel like partners in. It's been empowering and reaffirming for the women involved. There's been a shared responsibility across the partnership in this. And I think this chimes with what some of the other speakers have spoken about. The expert group haven't just met with the chair of the Violence Against Women Partnership. The women have met with the CEO of the council, the housing officer developing the domestic abuse policy, chief inspectors from Police Scotland, the Safe and Together leads within the council, and they're due to meet with the head of education soon. And I think it's really, really important that violence against women isn't just seen as an issue for one agency or department within an agency, but that it's recognised as being an issue that is cross-cutting, whether it's housing repairs, access to public transport or police and social care services, and that responsibility and accountability to survivors is shared. It's absolutely key in this for too long, and this harks back to what you said at the beginning, Councillor McMahon, about actually this isn't a women's issue. It's also not a women's aid issue. It's an issue that cross-cuts and has massive impacts for the whole of society, and we need to get away from it being seen as a social work issue or a police issue. It's an issue that affects everybody and needs to be dealt with across all parts of our statutory organisations. Secondly, for us to be successful in meeting the aims of Equally Safe, it's essential that as well as seeing leadership at a strategic level on this issue, that we see that leadership throughout organisations, including most importantly on the front line. During Sophie's presentation, my eye kept on being drawn to the footer at the bottom of her presentation, which is, if not you, who? And I think that's absolutely an approach we need to have when we're talking about violence against women. We need all staff to be empowered to identify violence against women and to take actions to ensure that the systems and structures that we have in place don't create often unintended barriers. And when they do, that we take action to ensure that these things are resolved. Without frontline staff being part of the revolution that's needed to ensure that violence against women is everyone's business, then actually the strategy and the policy documents might as well just stay in the drawer. And thirdly, well, the commitments to policy improvements around violence against women and gender equality at a national and local level are absolutely welcome. These absolutely need to be backed up by the resources to ensure that they lead to meaningful change in women, children and young people's lives. As part of this, we need to ensure that a gendered lens is being taken across all agencies and departments, and it's not just seen as a domain for certain staff in certain departments. Gendered impact assessments of budgets and spending decisions need to be part of our landscape so that we can ensure that the rhetoric around addressing violence against women becomes real and that we're able to take further strides to eradicating it and creating a more equal society. And on that note, I'm going to hand over to Janice.
Brilliant. Thanks, Heather. Thanks. I'm just going to try and be really brief here. And on reflection, in 2017, Anna Mitchell, who just spoke earlier, delivered a really powerful presentation at the National Violence Against Women Conference. And Anna talked about the passion, the power and the politics, which is a quote from the Green Book published in 1999 in Developing a Coordinated Response to Domestic Abuse in States. And thinking about this from a whole systems approach, violence against women partnerships have lots of passion, dedicated people who are passionate about tackling gender-based violence, and this is certainly the case locally. We have passion, compassion and a real desire to drive significant change. We have the politics, In Scotland, we have a clear political agenda to eliminate all forms of gender-based violence, a joint strategic national plan with a gendered analysis recognising gender inequality as the root cause. And locally, we have a strong, equally safe improvement plan underpinned by a clear focus on recovery, which recognises the need for specific action to strengthen capacity across the whole system to ensure recovery needs are recognised and addressed. But what about the power? Do we have the power to drive whole system change? And what are some of the critical components? Strong leadership and strategic buy-in is absolutely critical, and this needs to involve all relevant policy areas and decision makers, including child and adult protection, community justice, health and social care, drug and alcohol partnerships, and the voluntary sector. Councillor Evison spoke of the importance of collaborative leadership. We all have an opportunity to lead, and this is certainly our ethos locally. Heather spoke about the importance of listening to and involving the voices of lived experience. Their voices are heard and directly influence the actions that we take to prevent and address gender-based violence. It's vital that both policy and practice join up and that effective systems are in place across the different policy areas, and that gender-based violence is embedded in both strategic and operational plans to improve outcomes for women and girls. This was raised earlier also in relation to embedding trauma-informed practice across the system. Locally, it's important that our improvement plan recognises and includes, but not limited to, specific actions which will be led by the CPC, ASP, ADP and Community Justice Partnership. Gender-based violence is championed at senior level at partnership meetings. We need to invest in workforce development while ensuring professionals working at all levels have the support they need to improve their practice, as well as to provide scrutiny and oversight to ensure this happens. At a local level, we've taken significant steps to review and improve the multi-agency pathway and response in relation to domestic abuse through the implementation of Safe and Together in MARAC. Strong governance and accountability arrangements need to be in place. Locally, the Violence Against Women Partnership is firmly established within public protection arrangements and reports directly to the Chief Officer's Public Protection Group. Ultimately, we report to survivors directly on the actions we take. Resourcing, the reality is that the current funding landscape is both fragmented and inadequate to meet current need and demand, and it's vital that equitable, adequate and sustainable resource is put in place. Looking forward towards recovery, it's heartening that there is a clear national commitment to strengthen capacity and support in the next phase of Equally Safe, and that this will include identifying the collective leadership and resource required to take this forward. Thank you.